To thank the organizers and my special thanks to Dr. Kalra, my very old associate, and I can call him my guru also for some time, for giving me this opportunity and giving me this honor to be with you and chairing this session. And the session nonetheless one of the very important aspect, and yes, at the present context, gaining lot of attention into it. The simple reason is this: the patient safety is a fundamental element of our healthcare, and all healthcare professionals have a prime responsibility to save life and improve the health of the patient, and to prevent transmission of the healthcare infection associated with unsafe medicine practices. And adherence to safe injection practices and related infection control is a part of this responsibility, that is protecting both patients and healthcare workers. And injection is one such thing which can affect both. Not only that, it also affects the community if we are not properly disposing the waste part of it. Injection, with this peculiarity, have got its relevance, its demand, both in professional as well as in the patients. Because many times, particularly it is seen among the illiterate patients, they themselves, ask for it. They will go and ask the doctor to give him the medicines through the injection. बहुत जबरदस्त मेरी वो है, बुखार है, बहुत जबरदस्त दस्त लगी है, सुआ लगा दो. So that kind of demand is also there, for which sometimes the health professionals are forced to give these things. Not only this, sometimes even in the community it is not through the waste disposal. It's sometimes that maybe for other peculiar reasons, these injections are misused. I have seen one such facility, health facility. I won't call it as a tertiary level or secondary level facility. It was near the Mathura refinery, and there, while I was going through that hospital, I couldn't see any waste management, or rather that containers where these injections are collected or they are being put into this. While I asked, why are these syringes and needles? They said, in this area, after giving the injection, the patient will ask for it and they will take it with them. I said, what good reason for it? They say, no, actually, there this milching animals, that is the cows or buffaloes, need to be injected, and they try this one only. Just think of it, how dangerous it is. That thick skin and injecting with 22 or 20 number syringe needles. Many a times they are missing the skin and injuring themselves. And believe me, while I further probed, they said, yes, they have got the incidence of jaundice or hepatitis and alarmingly high in that region. So friends, unsafe injection practices are increasing, recognizing as a major resource for infection with bloodborne pathogens, including transmission of HIV, hepatitis B, C, D, amongst other worldwide. In the world, almost 16 billion injections are administered each year, and 25 to 30% are in this country, in India. And one of the studies have shown, on an average, almost 3 injections are being given to a person, per person in this country throughout the year. So friends, this is really a very, very, a matter of concern, and we need to look into this aspect, particularly for the safety aspect of it. And without taking further time, I would like to invite the esteemed speakers for this session. First and foremost, Dr. Inder Prakash, Deputy Director General, Public Health, DGHS, Ministry of Health and Family Welfare. He is also monitoring the functioning of public sector, Vaccine Manufacturing Institute, coordination, production, demand and supply of the vaccines, and private limited. That's the topic he will be doing. And also I'd like to invite Dr. Chandrakant Laharia, and his topic will be, that is the WHO guideline on safety engineering syringes and therapeutic care in India. He is a national professional officer, Universal Health Coverage, World Health Organization Country Office in India. Chandrakant Laharia is credited with introduction of proven health interventions, that is new vaccines including measles, second dose, hepatitis B vaccine, Haemophilus influenza, type B, HIP, as pentavalent vaccine, and the National Health Program. So, and the third one is Dr. Shushan C. Winkler. Madam, she is as Chief Risk Management Officer at Levitt Partners, a national healthcare consulting firm. She advises corporate executives on policy and business matters such as medicine, Medicare and Medicaid, FDA practice and alternative payment model. As CEO of the Food and Drug Law Institution from 2009 to 2014, she provided attorneys, regulators, industry leaders and consumers with journals, meetings and a neutral forum for addressing domestic and global issues. So with this, now I first invite Dr. Inder Prakash to deliver his talk. Dr. Inder Prakash.
Thank you, Dr. Jayant. Before starting discussion in the matter, I would like to thank the QCI for inviting me for this talk, which is a very, very important at this point of juncture in the Ministry of Health and Family Welfare, from a simple point of view that the program of patient safety is being run by almost all the program divisions, but there is nobody taking the ownership for this program. So, without discussing much, we will go through the slides. Okay, presentation of the slides will be through the different segments of background of the system, dimension of patient safety, injection safety concern, achievements and way forward. Now, just for the introduction, the patient safety is a component which is the absence of preventable harm to the patient during the process of healthcare. Simple words. And medical errors is something which is a term which is used to describe the incident that happened by mistake during the medical care. These are the two interrelated terms, and this has grown up a full-fledged discipline of patient safety in the medical sciences. The historical references which are available in the development of the patient safety concept range from 500 BC when Hippocrates referred this concept, and then quite a significant time for the first reference in the modern era of 1960s came up about the modern safety. 1909, Six Sigma quality came up, and the landmark is in 1999 when the publication to It is Human, which is the landmark publications and led to WHO come up with the World Health Assembly regulations, and in 2005. Now, if we look at the unsafe care burden, well, 42.7 million people out of 421 million hospitalized, they have one or the other adverse event, which is converted 1 in 10. Every 10 patients which are admitted in the hospital, they have a adverse event. And the same line, 7 million complications developed and 1 million deaths during unsafe surgery. And 1.4 million suffer from the hospital-associated infection. This is the type of unsafe care warden in the country. Associated with this, the second aspect is the injection safety, which speaks each year unsafe injections cause 1.3 million deaths and 26 million years of life loss. Now, further to the injection safety, which is the main focus of the talk today, 16 billion people, billions of injections are given worldwide in a year, of which 40% are estimated to be unsafe. This is a huge amount, huge amount. Looking at the burden, the patient safety is therefore a global health problem which need to be addressed appropriately by all the countries. Now, different dimensions of patient safety, which comes up the medical error, taking medicine correctly, hospital-acquired infection, quality safety medicine, injection safety, which is the focus point today, maternal and child health safety, patient participation in clinical trial, advocacy, and education. I will come straight forward on the injection safety component, which is described by definition, that is the administration of a system of administration of medicine parentally. Well, there are safe injection practices and unsafe injection practices, which are like this. The safe injection practice, which does not harm the recipient, which does not expose to the health workers to risk, and does not harm the community. The unsafe injections, usually defined as reuse of the devices, unhygienic practices, wrong techniques, and waste management failure. Now, if further, when we look into the magnitude, 16 billion injections, which I have already expressed, 6.6 billion, which is are reused equipment. It is 40%, 39.6% is a huge amount, which is reused equipment. Over 75% of injections which are given to the people, they are not necessary. So here is the big fault where when the Dr. Jayant was expressing why people want the injection, only injection medication, so 75% can be prevented. Unsafe injection practice cause annually 21 million hepatitis B among all cases, 2 million hepatitis C, and 260,000 HIV/AIDS infections, 3 million accidental needle stick injury, which is part and parcel of the healthcare providers, and every year unsafe injection cause 1.3 millions of death. Looking at this big, huge amount of, this is global figures, but when we look at the Indian figures, it is something like that, 4.8 billion injection per annum, which is 30% of the 16 billion. So 13% is the load in India of the global injections which are administered to the people. 2.9 million injection per person per year. 2.9 injection, that is almost 3 injections on an average, each person in India get receive the injection administration doses. 82.5% for curative and 62.9%, that is 1.9 million injections, are considered unsafe. So if we look at the Indian data, this is a slightly older data, 2002, 63% of the injection which in India are administered, they are unsafe. What are the concerns? Looking at the concerns, the reuse of injection equipment for administering injection is one of the biggest concerns. Number 2 is the accidental needle stick injury, that is a part and parcel of the healthcare workers, including ourselves. The third concern is the overuse of injections for health conditions. That is why 62%, 70% of the injections which are not required, they are administered, where it comes the overuse of injection. And the unsafe sharp waste, that is, whatever is administered, the waste is left in the form of a sharp needle and the syringe, they are not disposed of properly, and therefore there is a problem. Key milestone in the injection safety, which is started from 50s with glass syringes, in 60s the market authorization to the sterile single use syringes, then 90s came the market authorization to AD syringes, then 1999 WHO, UNICEF, UNFPA joint statement on the use of AD syringes for immunization purpose. 2003 WHO signed guiding principle injection device security, and 2004 market authorization for rub and SIP. 2005 is again a big landmark when the World Health Assembly 55 1.8 quality of care and patient safety was passed, referring the injection safety. 2006 is the ISO standard for rubs, and 2012 is the ISO standard for SIP. These are the different landmarks in the development of the injection safety. Slightly moving away from the injection safety, because injection safety is a part and parcel of the patient safety. So what is the current scenario? The patient safety programs, the goal is, the overall patient safety strategy is to improve the patient safety at all levels. And along with this goal, the objectives which are identified are sixfold, which Dr. Areen has explained nicely in the morning session. Each objective is translated into strategies, 24 strategies for patient safety, and similar type of strategies are identified for injection safety, which are classified into 5 categories. That is the national policy for safe and appropriate use of infection, procurement of equipment and supplies, management of sharp-based, capacity building and training of healthcare workers, behavioral change plans. So these are the types of the strategic framework which has been brought out or discussed, available in the literatures, being implemented by different program divisions and different departments, without any ownerships. There is no single point identified where the program is being implemented. Every program has these components they are implementing, but without coordination with one another. Looking at these strategies, the achievement which has been made so far, from 2000 to 2010 in injection safety, there is 60, after the implementation program in different program divisions and different countries, 86% reduction in reuse of injection equipment. That is from 39.6 to 5.5. This is a big achievement that after the implementation of the program of injection safety at the international levels, then to the national levels and regional levels, significant decrease in reuse of injection equipment. 66 of the 75 countries are using auto-disable syringes. 87% reduction in HIV infection due to unsafe use, that is decreased from 280,000 to 33,900. This is also a big leap. That is 80% reduction in HIV infections, which is a very important program in India. 83% reduction in hepatitis B virus infection and 91% reduction in hepatitis C virus infection. This is also one of the very important programs associated with unsafe injections, and significant reduction at the during evaluation in 2010. Average number of injections per person in the developing country has reduced from 3.4 to 2.9. 2.9 is still the figure for India. Therefore, we need to validate this figure whether we have reduced or we have increased. After looking at the international assessment of reduction in the injection safety, these are the achievements in India. Based on the different strategies which we have highlighted, the surveillance system, setting up of the surveillance system, no specific surveillance system exists. The available informations are that the pharmacovigilance is looking after the adverse effect following immunizations and medications, but largely not available for public use. International classification, very difficult to find out. If an event has occurred, whether it is referred properly and classified properly, no initiative taken so far. Then recent research in patient safety, very, very limited. Very, very limited projects has been undertaken in India. Solution for patient safety, yes. There are certain things, but then they are not in a coordinated. Different program divisions are implementing this program. Number one is the Clinical Establishment Act, blood safety guidelines and hygiene. Injection safety has been being shared by the two departments, mainly the UIP, Universal Immunization Program, and NACO, National AIDS Control Organizations, which has a major role to play in the prevention of injection, unsafe injections. Then specific disease control program guidelines. Each program has their specific guidelines which are referring correct medication, correct injection choose. The next component is the High Five initiative, which include concentrated injection medication. Yes, there is a possibly reductions in the overuse of the injections, medication accuracy at transition in care, correct procedures, and communication failure, which is most important in almost all the programs. Then hospital-associated infection. This is also one of the major area. Hospital-associated infection, some work is being carried out in India, and the guidelines has been developed for implementation. Associated with this is the major achievement in India is the antimicrobial resistance, which is has been launched in a big way to as a national program. Technology for patient safety, well, the different aspects are the information technology, making technology safer, introducing new technology, and training on simulation. We did not find any reference in India whether these things are being carried out. There must be, but we are not aware of that. Tackling antimicrobial resistance, yes. A national program has been launched in this on antimicrobial resistance through NCDC and being implemented in India. Patient safety challenges, many. Clean care and safer care. And the safe surgery, these are the two initially identified, and moment the program will be advanced in many other challenges will be coming up. But these two challenges has been addressed adequately, and the guidelines are available which can be replicated by the different program divisions. Elimination of central line associated with blood smearing, yes, this is being addressed through the NACO. The patient, for patient safety, yes, there may be, but there may not be. But since the program is new and there is no nodal point, we are not aware whether any of the NGOs and patient for patient safety are have some organizations or not. Patient safety award. When there is no focal points, there's no need. We did not find any focal point for this. Education and training, no. Knowledge management, no. And prevention of healthcare associated infections, yes, there is something on this. Now, these are the achievements in different aspects and different strategies in respect of patient safety, injection safety, both. We need to have to do much more what we have done. This is why we propose how we can go ahead. Number one is the ownership. As on date, there is no single point identified who can lead the patient safety program. Just recently, our program division has been identified as the nodal point for patient safety, and we are coordinating and taking the program forward. And we have planned to discuss the various issues and concerns in the first week of September. reaching scales and decentralizing procurement. This is a very complicated, procurement is a very, very complicated issue. Different agencies, different program, individual program. But what is needed is we need to have a decentralized systems and procure in bulk and supply to the same source. Broad participations, not yet. We need different partners, right from the community to the experts and the apex agencies. We hope that this will be done. Community participations, no, not involved so far, but it's important. Any program, no program can be success without the involvement of community. IAC, no plans, capacity building, very limited. Surveillance, not. But in some specific aspects, it is there. Research and patient safety need to be promoted. And more important, whatever is being done, that need to be monitored and brought to the board. Thank you very much.
Thank you, sir. Thank you for being within time. Yes, these issues and the burden of this problem is still quite high. And I fully agree that other interventions which the government of India and other stakeholders are taking care of. But the main thing what we should also focus on is the awareness and the community participation. You are very, very right in this issue. So it is the awareness among the professionals, among the patients, and definitely among the community also. Now I would like to call upon Dr. Chandrakant Laharia, the National Professional Officer, Universal Health Coverage, World Health Organization Country Office in India. Dr. Chandrakant, and he will be talking on WHO guidelines on safety engineered syringes in therapeutic care in India. Dr. Laharia.
Thank you very much, Dr. Das. My task is much simplified. Dr. Indra Prakash shared some of the key findings or key facts, data on injection safety. But I still believe that this data is so powerful that it needs to be shared repeatedly. So some of the slides or some of the information I would deliberately repeat. I think you would find it useful. We heard and we know that if you go to a healthcare facility or a doctor, you might receive an injection. So injections are an integral part of health services. Like, it's not that injections are bad. What is wrong that injections are unsafe. So globally, as part of healthcare, injections are given. The number is 16 billion for year 20 to year 2000. 15 years ago, 5% of these injections are given in immunization program, but 90% in therapeutic care. When you go to a primary health center, you go to a district hospital, so 90% therapeutic and remaining IV blood transfusion. What is worrying more than numbers is that nearly 50% of those injections are unsafe. And this could be a variable reason why they are unsafe. And if we look into India or Indian data, in year 2002 and 3 billion or 300 crore injections were being given. Similar to global average, but what was worrying or is worrying that two-thirds, more than global average, nearly two-thirds or 63% of injections were found unsafe in India. Though some changes have occurred, but things are likely to remain more or less similar. What makes injections unsafe? It could be reuse of injection equipment or accidental needle stick injury to healthcare worker, overuse, patient demand injection, and when there are oral medications available, the injections are offered. And then sharp, the needle or other sharps disposed from those. So that's what makes injection unsafe. What was happening due to those unsafe injections in year 2000? That nearly 40% of those injections were being given through being given through syringes which were being reused. This was causing approximately 32% of all new hepatitis B virus cases, nearly 40% of all new hepatitis C cases, and 260,000 HIV cases, 5% of all new. So, due to unsafe injection, this many new infections were happening. If we take preventive measures to reduce these unsafe injections, costs will be much lower. But if you start treating people who are getting sick due to unsafe injection, cost would be much higher. So making injection safe is a cost-effective intervention. It reduces burden on health system. It prevents cost on governments. So there are benefits or advantage in making injection safe. Dr. Indra Prakash also shown this slide. The point here I want to highlight is that you do what is current standard of practice at that time. Some of you might remember that glass syringes were used to administer injections. But the reason is that there was a time when the glass syringes were the only syringes available. In 1950s, they were the only syringes. There were no plastic syringes or conventional syringes. So the conventional syringes which still used in therapeutic setting or hospitals, traditional syringes, were become first available in 1960. So what was made available in 1960 is still used in healthcare facility. They are theoretically single-use syringes, but they can be repeatedly used. So it's okay that you use currently available technology, but it's equally important that you use if the new technology is available, if new things are available. And one of the most important developments and learning during the injection safety or injection usage has been availability of auto-disable syringes. What we use in immunization program, AD syringes, which cannot be reused. In India, immunization program use auto-disable syringes only. They first become available 26 years ago only. 1990, they received market authorization. 1999, WHO, UNICEF, and UNFPA gave recommendation that immunization program should use AD syringes only. 2004 and 5, India became the first country, not first, one of the early adopter country in the world to use AD syringes for immunization program. And you see the evidence that with a single intervention, today immunization program injections are much safer than any time in history. Earlier when injections were given with glass syringes and thick, higher gauge needle, there were more abscesses, more pain or issues. But today, with a single intervention with those syringes, immunization program has become safer. What is new since then? There are other syringes which are called reuse prevention or sharp injury prevention syringes, which have become available 12 years ago in 2004. A number of countries have started using those syringes. These syringes, if I can simplify, are more or less similar to auto-disable syringes. That only broad difference is that auto-disable syringes comes with a fixed dose formulation. There comes in 0.1, 0.5 ml, while reuse prevention syringes are flexible and different variable doses which can be used in therapeutic care. So these have become available. The advantage of these syringes, or safety engineered syringes is another name for these syringes, is that after a single use, there is some mechanism by which it gets logged or destroyed, so it cannot be reused. So these syringes are safer than the conventional syringes. The experience globally has shown that if you pay attention on making injections safe, it drastically reduces various infections. So during year 2000 to 2010, because of use of safe syringes, the number of new infection has gone down drastically, which is a proof that if we work on making injections safe, it delivers results. On injection safety, more specifically WHO work and WHO engagement at global level, I already highlighted the global statement on use of AD syringe in 1999. WHO released a guiding principle to ensure injection device security, 2003. There are some best practices published in 2010 There are a number of World Health Assembly resolutions. So injection safety per se, going very specific within the broader context of patient safety, WHO has done many guidelines and specific work. What we might have seen outside and some of you might have picked are these is the image of those guidelines which are kept outside, and WHO has released in year 2015, last year in February 21, the guidelines on the use of safety engineered syringes in therapeutic care, more specifically in intramuscular, intradermal and subcutaneous injection in therapeutic care. What it talks about that conventional syringes which can be reused and which are a risk to beneficiary if reused should be replaced with the safety engineered syringes. The recommendation as per these guidelines, and if you pick a copy from outside you will see, and these are detailed 50-page document. I'm reading recommendation that the WHO recommends use of injection devices which have a either reuse prevention feature. So these are two recommendations. They recommend reuse prevention feature as against the normal syringes, or if you decide the use of sharp injury prevention feature syringes over the traditional syringes. On the right hand side of this slide you see the image of reuse prevention feature syringe. In this there are different types. Some syringes if you press them they get locked so you cannot pull back the plunger. But in this one, what you see, the plunger is not here, plunger is totally separate. So if you try to pull it back, the plunger is broken and then you cannot be reused. So these devices make sure that injections or syringes are not reused, which is a major step because you can recall that 40% of injections at one point of time were given by reuse of syringes. Another on right hand side lower corner you see the safety sharp injury prevention devices. There is a plastic cap. After giving injection you press that, it irreversibly stay on the needle. So needle cannot it cannot be removed, so it will not lead to the injury. So these are the new devices which WHO recommend for therapeutic care. And we should not forget that therapeutic care is 90%. What we have achieved through immunization program is only 5%, in case of India around 12%, but therapeutic care is 85 to 90%. And if this intervention is done, you will prevent 85 to 90%, you will make 85 to 90% injections safe. Well, these guidelines are global in their scope. Global means they are for all countries. WHO has given for all countries. These have been recommended based upon a detailed review of literature, review by experts. These guidelines were published on web. Experts gave their comments. So this has been developed through a adopted procedure which WHO always follow. These are for all injection procedures, including intramuscular, intradermal, subcutaneous, including reconstitution of medicines and vaccines. Though these are guidelines do not cover intravenous injection as of now. There would be separate WHO guidelines for intravenous injection. The objective of these guidelines is to support member states. Member state means country which are WHO member, and other development partners to make an informed decision that countries should consider that WHO has released these guidelines and they can take a call whether they want to adopt these guidelines for their setting. And these guidelines supplement the existing WHO material, AD-MEMOIR and other flyers, which already provide information how to make injections safe. For example, the AD-MEMOIR, which is 2-page, which is also outside, talks that injections do not become safe simply by switching to a different type of syringe. It's a process and there are components. The process is that you adopt a policy to use different type of syringes. Then you go for a procurement, then you show that facilities are using those syringes. It also, injection safety also demands that community behavior need to be altered. The healthcare behavior need to be altered. Their capacity need to be built in use of new type of syringes. It also demands that you can have a policy, but if there is no equipment or no supplies available, it demands that supplies are available and they are available at the cost which is affordable. It should not be very exorbitant over the traditional one. It also demands that to make injection safe, you have to dispose of that waste. If you are going to use one syringe one time, that means there will be more waste. There will be you have to develop mechanism to ensure the safe disposal of waste. So there are multiple dimensions and components, and when policies need to be made, it need to be paid attention. This is another the flyer which I already shown. These points I talked about, that these guidelines aim to reduce reuse of injection, change behavior, reduce needle stick injuries, prevention of overuse of syringes. The entire idea in the WHO policy talks about that by 2020, 2020, by year 2020, all countries should adopt or switch to a safety engineered devices. So there are 5-year time period WHO suggests that countries should adopt this. What needs to be done by different stakeholders in this period is that government should focus on adoption of this policy. Transition means that they should ensure that manufacturers are available who will make these syringes available. There are procurement guidelines, and then training of health workers should be done, implementation strategy should be done. At the same time, WHO recommend to donors and development partners that only new type of syringes should be funded if there is external funding, and provide necessary technical support, technology transfer to the country. The manufacturer, WHO recommend to manufacturer that they should switch to the new type of syringes. They should seek WHO pre-qualification. So there are multiple dimensions. That's why this 5-year time period is being given. More specifically, what countries should do that adopt the policy, develop some work on behavior change and patient-provider engagement, equipment supplies, management. So I'm repeatedly saying these points in more concrete terms, like there are 80 memoirs, but what it translates into more concrete at the country level. Okay, so that was more of a generic and broader. What does it mean for India and how it should work in India? I've already spoken those points. One point which a learned audience, if you are talking to somebody, they might say that what I'm talking, the data or information is pretty old. This was in 2002 and 3 and things have changed. People might argue. Whether things have changed or not changed, we don't know authoritatively. But what we know that infection, there are reports still from different parts of the country which say that due to unsafe injections, many of the outbreaks occur, hepatitis B outbreak. What we know for sure that 80 syringes are used in immunization program. Some practices have improved. There are small scale studies but not large scale studies. There are very few studies from India, but what is available says not very happy picture. Nonetheless, in India there are few development in last few years. Dr. Inder Prakash also discussed these, that glass syringes are not available. If you go to public sector, private sector, for sure the glass syringes have gone out of use. You will not find, like very rarely you will find. So that's immunization program use exclusive AD syringes, which is a good development. So definitely the proportion might have come down, but still we don't know, and there are estimates that this is around 40% of injections are still unsafe. In therapeutic care, plastic syringes are used, which are traditional, conventional, single use, but they are not, we don't know whether they are singly used or multiple use, but they are the syringes which are used. Many of the Indian hospitals have started using reuse prevention syringes, but that is very limited and ad hoc. Private sector, there is limited information, but traditional syringes are most commonly used. Informal sector, no information. It's important that injections are given by unqualified practitioner in all those areas. So that need to be paid attention. Report of reuse of syringes in print media, other informal sources often documented. This is one of the key slides which I want to highlight, and to any policy maker or any program manager in national level, state level, we need to look at this. The traditional syringes, widely used, they are meant for single use but can be reused, cost something like 1 rupee 50 paisa to 3 rupee. In government supply, bulk purchase 1 rupee 50 paisa. In private, around 3 rupee. Auto-disable syringes also cost similar amount. The syringes which WHO now reuse prevention syringes, at present they cost slightly higher, but around 2 to 5 rupee. But point here to remember is that the technology which is used in AD syringes and RVP syringes are more or less similar. And if there is a large scale use of these syringes by both public and private sector, the cost is likely to be similar. And in government supply, in immunization program, The auto-disable syringes cost 1 rupee 68 paisa per piece. The traditional syringes is 1 rupee 50 paisa approximately. So new type of syringes are also likely to be the same cost. So that means if across the country, where in India around 400 crore injections are given every year, the total cost will be at the maximum 50 paisa per syringe higher, so 200 crore for across the country. In public sector, only 30% of the injection healthcare is provided. So public sector, only 60 crore additional cost you can make all injections safe. In private sector, obviously it's a smaller cost. So these syringe injection could be made safe at very minimal cost in comparison of advantage of these syringes. And it's not like, India is not like any other country in the world where you don't have syringes or you import syringes or you need to, and the cost is much different. India has large number of syringe manufacturers. There are 4 or 5 large manufacturers. There is sufficient production capacity. So this is one country which should immediately do is before anybody else. So all is not that bad. Government of India, Ministry of Health and Family Welfare is seriously considering this discussion, seriously considering this aspect. They have formed a technical expert group on injection safety which met, deliberated on these aspects. There are various aspects being discussed. One of those is that the Government of India has proposed a nationwide rapid assessment of injection usage and practices, which will provide more recent data and help them in informed policy decision making. Final section, last 2 minutes, I want to talk about WHO's engagement in this and WHO technical support to Government of India. So WHO with Ministry of Health and Family Welfare has developed the injection safety implementation project for India. This project would support ministry and some states in India to make injections safe. This is part of WHO's global project, 3 countries, India, Egypt and Uganda. So 2 other countries are Egypt and Uganda. WHO will provide technical support national level and to Punjab state of India. This has been agreed and we are working on that. This support would focus on development of providing entire spectrum of technical assistance, including policy decision making, development of guidelines, procurement, capacity, baseline assessment, capacity building, healthcare waste management. So entire spectrum, all aspects, we will be working with Government of India. We will also be working with Ministry on conducting nationwide assessment of injection usage and practices in the country, which Ministry has interested us. So this project was launched on 28 July by Minister of State Anupriya Patel and Amitabh Bachchan, and on left hand side you see WR India, Dr. Hank Beckedam, and right regional director. And if you missed, I am also there in the photograph. I'm not showing this photograph to show myself, but I'm showing that this project has highest level of ownership, agreed with Government of India, released by Minister of State. It was supposed to be released by Mr. J.P. Nadda in Mumbai, but he could not join, and Mrs. Anupriya Patel, who is Minister of State, Government of India for Health and Family Welfare. So this is the work which we will be doing, and this project would be released, this project is being implemented in the country. To conclude, WHO guidelines recommend use of safety engineered syringes. That's a generic name for the 2 types of syringes, reuse prevention and sharp injury prevention in healthcare setting, in therapeutic setting. It's an opportunity to look a comprehensive picture and take comprehensive steps to make injections safe, and it's a step toward improving patient safety. India is best positioned to achieve this because they have syringes, their cost is low, their quality is high, and there is in-country production capacity. All that need to be done is that we need to sustain the efforts. And WHO India is supporting these efforts and committed to support these efforts. Thank you very much.
Thank you, Dr. Chandrakant. You are absolutely right. Injections are not bad, but it is the overuse or misuse which is really, causing or increasing the burden of unsafe use of injections. And definitely we need to, very careful and look into these aspects, and more emphasis to be given for this rational use of injections, and introduction of this safety engineered syringes, and as the comparisons you have given. So these are really quite interesting, and all of us will be very eagerly looking forward for the outcome of this technical assessment which you are planning to do. And I'm sure with this, and as you have shown that the number of injections per person per year is coming down from 3.4 to 2.9, though it is very small, but that is the significance that the trends are coming down. And with this, more awareness among the practitioners, among the patients, among the community, I think we will be looking for some better results in near future. Thank you so much, Dr. Laharia. So now I'd like to invite Susan Winkler. She will be talking on strengthening patient safety, focus on injection safety, quality equipment, and injectables are essential. Regulatory reforms will advance. Dr. Susan.
Great. Thank you very much. First, I really appreciate the invitation to participate in the panel today, and certainly to join the impressive co-panelists who've done just a great job of laying out this issue. A sign of a good panel discussion is if you come from different perspectives and cover different issues, and I think we'll do that for you today. In that Dr. Prakash has given us a grounding in the incidence of injection safety issues in India and the improvements being made. And Dr. Laharia provided an overview of the importance of continuing practice advancements from glass syringes to safety engineered syringes. And so I will talk about, although they have the wrong set of slides loaded here, the importance in injection safety that relates to the very product and the importance that the product is safe. So what I speak to here, as you may have seen in the program, I am served at the US FDA, where we worked on devices like the safety engineered syringes, as well as the product that was being injected. And so what I want to talk to you a bit about today is the importance of making sure that the product that is being injected is safe and is produced in a safe manner, and talking about that a bit from the regulator's perspective. So the good news about the fact that they had the wrong slides, actually if you put those back up, there's one slide that I can use because it's similar from a different presentation. So if you put that back up, I can cover it. The importance of knowing what is in the vial so that what is injected is safe is something that comes only from a product of having a quality, that you have regulators that are setting a standard that regulated industry can meet, that you have regulated industry who is working to meet those standards, and then that you have healthcare professionals who understand how to use that product. So I'm going to talk about one specific piece, if you'll forgive me while I go through here. So this is what I will speak to and get into some of the detail that helps us make sure that you have a quality product being injected, as well as quality devices that are being used to deliver that. In a strong regulatory system, which India has but continues to improve, as do countries around the world, that strong regulator needs to first know who is being regulated. So you have to know who is doing what. If we're thinking about the issue of injectables, it's important that the regulator knows what companies are engaged in what activities. So who is producing the injectable product, who is producing the syringe, and what is it they're doing. From a healthcare professional perspective, who is it who is administering injectable products? That varies around the world. In the United States, pharmacists or chemists here administer the majority of adult immunizations. It takes place in a pharmacy, not in a physician's office. And so it's important for those who are engaging in work to improve injection safety practices to know who it is that you need to change and improve their practices as we can continue to advance the work. So it's important in a strong regulatory system to know who is being regulated. Then it's important, and this may seem obvious, but you need to know by whom the regulation is being done. And this is an important dynamic when you have multiple regulators, so multiple regulatory agencies at both the national level and the state level. It's important among the regulators at the national level to understand what it is that the Ministry of Health and Family Welfare is doing and what is the responsibility of another ministry, as well as to clearly articulate the responsibilities of a national ministry and the state level regulator. So what is it, if we think here about the product that's being injected, what are the responsibilities of a regulator at the national level, and what are the responsibilities at the state level, and making sure that we have clarity there so that regulated industry knows to whom they can ask questions. Then the final piece for a robust regulatory system that helps us both have confidence in the product being injected and change the behavior for the healthcare professionals who are doing the injecting is to make sure that we know to what standard those entities are being held. So what is the expectation when it comes to producing an injectable product? What is the expectation when it comes to producing the syringe to deliver that injectable product? And what is the expectation for the healthcare professional who is engaged in these activities? Then there's an important piece that is often forgotten, and that is that you need to continually advance that standard. As practice changes, as we learn more things about how to produce products in a safer manner, how to have devices that help us deliver the product in a safer manner, how it is that healthcare professionals should change what they do, either in training patients in their injection practices or in the healthcare professionals' injection practices themselves. So it's an important understanding that in all of this, when you are determining according to what standard it is that you will regulate, that you continue to advance that standard. And so to gather feedback that we knew we needed to move away from glass syringes to the safety engineered syringes, to learn that we needed to do a better job of producing the vaccine that was put into the vial or the sterile product so that it would maintain sterility. I'll give you an example of an emerging practice that's related in injection safety, and it's emerging practice around the world to do a better job of tracking the vaccine through the supply system so that we know that it has been held according to the standards that are important in order for the vaccine to deliver what it is supposed to do. As those efforts mature, we learn and can go from beyond, in some countries where they are able to track the product moving from the manufacturer to the stockist to the chemist, to not only track the movement of the product, but to track the temperature of the product as it moves, so that you know if the product has ever been out of those specifications that we set. So there's I say this all to say that we're in an environment where we're continuing to make improvements in injection practice, and particularly as we look at how we do that from a regulatory perspective, that we can make advancements for the product that's being made, the device that delivers it, and the healthcare professionals who use that product, if we assure that our regulatory structures continually advance, that we have clarity about who does what, and that most of all, that we understand the regulated industry that it is with whom we're dealing. So with that, I'll thank you, and we can, you can be glad that I've spoken enough about this issue that I don't need slides in order to deliver something that I hope was at least a bit helpful. Thank you.
Thank you very much, Shushan. And yes, it is also one of the very, very important aspects, particularly when the patient safety is in concern, and particularly the regulatory of the products. And until unless we are having a very well established and strong regulatory priorities and the mechanism to do it, and with clearly articulated, regulatory responsibilities, particularly when we are having multiple stakeholders to look into this aspect. And also, we need to have a very well articulated, clear-cut, regulatory standards. So until unless these things are not there, it is definitely, indeed, it is quite a difficult one, and we need to look into these aspects, and definitely should take care of this so that we can make these things more safe.